All right, so here we are, beginning of the session. Regardless of whether you are an esthetician or a massage therapist, um, you could this is how I would do it if I was an esthetician. With massage therapy, I weave it in and out, but I'm going to do both, okay? So first of all, what you want to do is you want to get whatever medium you're using, and you want to put it on your hands and apply it to the lateral arms and then up the neck. Once you've got that application of medium on, you can just reach over and grab your stones. Here, I've got one of each right now. So moving motion, lateral arms. That's it. 2 strokes is all you need for your client's nervous system to feel that heat. And from then, you can go all the way up the neck. Now, if I was to start, and this is really important because people who use any kind of hot stone oftentimes don't do this, and they will start on the neck, start up here, start in areas which are really sensitive, and they don't burn the client, but they'll startle them. And you do not want to startle your client. They'll never tell you that they've been startled, but they're getting out of that nice relaxed state that you're trying desperately to get them into. So really important. 1, 2 strokes on the lateral arm. That's all you need. Their nervous system feels the heat, and from there on, you can come up. Now, these stones are just nestled between my hand and my client's neck. There's a really wonderful radiating heat now going right on the neck area where for so many people it's tight. Now my fingers are actually doing the work. My fingers are coming up the vertebrae and I'm leaning back in my seat. I'm not engaging my biceps whatsoever. And of course, I'm sitting down. So you can find that you can incorporate these stones specifically as a massage therapist in so many ways. And it's so easy. It's why I've been able to still be doing massage full time after 33 years. The burnout rate for AMTA have said it's around 6 years. And it does not have to be that way. The stones, when you incorporate them, really are able to make your work so much easier. So the heat is here. It's right in that area for so many people is tight. And my fingers are working up the neck. From there, we can come down, back up along here. There we go. In fact, when I did the first application, I didn't come along here. So some jojoba in my hand. So lateral arm, and then along here, meet in the middle, come out. And, you can create a session, as massage therapists and estheticians, whenever we work, we're very creative with the work that we do. So this is how I do it. This is the easiest way specifically. Now you can also come down under. Now I have a 2.5-inch pad right here on my table. And the reason I have that is because I like to work underneath using my client's body weight. And I'm going to show you a little bit right now. I can come under here and I can do some really good work on the shoulder blade, teres major minor. I can isolate those muscles because I've got this 2.5-inch pad here. Most therapists do not do that, but this is when you use your client's body weight, it's so much easier. And again, as a massage therapist, I don't know what the scope of practice is for estheticians with exactly how much massage you can do. But if they're in this position, you're still working the upper back and the neck. So it's probably fine. So we've gone up the neck. We've come along the front area. And then we'll go up to the jaw, the masseter muscle, the area where so many people grind at night. The stone is still warm and the face is sensitive. So you don't want to ever start on the face unless you warm your stone, cool them down a little bit. But right now it's perfect because I've used it on the arms and the neck and it's still nice and warm. You can then flip over your stone and then you have another little blast of heat. So from here, you then go up to the most sensitive part of the face, which is the earlobes. And you can just put them over the ear and nice, slow circles. And you can try it yourself. Put the stone up on your ear after you've been holding it a long time, and you'll be so surprised at how much radiating heat is still coming off of that stone onto your ear, and how comforting and relaxing it actually is. So that's a really nice way to start your session as an esthetician. You can do it also as a massage therapist. I'd like to show a little bit of how we incorporate the stones with sideline. Sideline really is the most underutilized technique of massage today. I cannot say that enough. Majority of therapists don't do it, and I don't know why, because for all of my clients that come in with neck and shoulder issues or lower back and hips, in a 1 hour session, I will always do sideline. And I have a training online with it, and I go into it in depth. But it's such a beneficial way, and it's a great way to incorporate the stones as well. So I'm going to put this pillow underneath my client. It's a small pillow to make it easy to get into the area. So I'll put this under your neck.
And we're going to get back into some stuff estheticians do later.
Yes.
Okay.
And then I'm going to have you turn onto your side, towards here, please. And I'm going to put a pillow between your knees. Thank you. There we go. So this is a wonderful way when you incorporate side lying in a 1 hour session or an hour and a half. What you'll find is that the majority of your clients love it so much they want to go on to an hour and a half. That's what I found. And the majority of my clients are now hour and a half sessions because they love having some extra work on the leg and feet with the hour and a half. So on this side, I'm going to grab an oval. You guys have some ovals on the bowls. Sophia, could you put your arm outside up here? There we go, great. Again, we want to start on that lateral arm. There, lateral arm. One stroke is all you need. You don't even need two. One stroke. Nervous system feels that heat. They know it's coming, and then it's going up the neck. So the levator scapula is the most troublesome muscle in that neck and shoulder area. And it's one that can be worked it's very hard to work it in either prone or supine. But when your client's in sideline, especially when you've got that stone in your hand, that heat is radiating. And I'm not even holding the stone. It's just nestled there between my hand and my client's body. And my thumb is doing the work right on that levator scapula. It's really phenomenal, the results I get with people coming in with neck and upper back pain, tension, headaches, migraines, just by working this levator scapula. It's phenomenal. Then also in this position, you can work it from this angle too. It's a little harder when you have the stone, but this is a great area to work the supraspinatus as well, which is one of the rotator cuff muscles. So you can flip it over now. It's a little bit warm out here. You come down the neck, and then you just push down and bring in your other hand, work that infraspinatus, which is just above that borderline of the scapula with the infraspinatus. The supra is up above. And again, this one is a big muscle for a lot of issues with tension in the upper back. And this is such an easy motion to do. Again, I'm sitting down. I do a lot of sitting because when you use the stones, you can. It's as simple as that. I'm just going to choose to get my other one now. Pop this up there. There we go. So working that supraspinatus and isolating that muscle. When you're able to isolate muscles with the stones, it's far more effective, and your client feels as if your massage is so much more conscious than if you were just flopping around all over the place, just rubbing the muscles when you're isolating muscles. So it's really, even if you need to go back and do a little bit of your looking in from school to see where those muscles are, it's really worth it because it's just a handful, like the rotator cuff muscles. it's hard to get the supraspinatus, the subscapularis. That one can't be reached with the stone, but the supraspinatus up here can. Right here. So then from here, I'm going to go down the back, and again, we're using our oval. Now, when I walk around and I'm picking and putting, I like to wear scrubs. You might want to try the website graysanatomy.scrubs.com, because it's really nice to have a pocket. Can you just show that, Rita? To have pockets, and you can just put the stones in your pocket so that you're able to easily just pick them up and put them back as you need to. So coming down the back, again, you're using it. You don't have to do this with every single massage. Depending, if your client loves the stones and they want to pay a little extra and you want to do a massage with about a stone in your hand for about 45 minutes, then that absolutely, can you come over here? Come behind me. There you go. Then you can do that. So again, talking about that muscle isolation. So we're isolating the quadratus lumborum now. I've got the stone right here in my hand. I'm feeling for that rib area underneath the rib, and my thumb is just very easily just coming down off of that QL. But again, the stone is right here delivering the heat. So same with the hips. I know one of the reasons a lot of therapists don't do side lying is because of the draping. They're intimidated by the draping. I go over it in depth in my course to make you very comfortable with draping, because it's very easy. It's really important to work this glute area, and it's so easy to work it when they're inside. And again, I'm still sitting down, so it just makes a session so easy. It why I can do back-to-back sessions, two hour and a half and an hour, absolutely without missing a beat, because I sit for a lot of the session and I let the stone do the work. The ovals are a little more heavier than the circles, and so this has quite a weight to it, as you guys know. I'm going to show you now how to do the legs. I'll put the stone in my pocket. We're going to drape here. A very quick drape. Again, we go over this in training so that your client is nice and snug. Okay, so I'm going to grab my stones here. I'm going to put them in my pocket. And I'm going to apply some of the jojoba. Maybe up a little higher, Meredith. Yeah, higher and closer. There we go. Okay. This is wonderful for prenatals. So I get in my pocket, my stone is in my pocket. I'm using the larger oval here. Here's the smaller one that came with your bowls. We can do either way. They both have that nice ridge on them. And this is wonderful to use along the IT band, which for so many people is so tight. So utilize that edge, The weight of the stone, you really do not have to do a lot of pressure at all, because the weight of the stone does the pressure for you. So as you're coming up and as you're getting up to the greater trochanter, you can put it down flat, and then you can just guide it around that greater trochanter. As you're coming down for the insertion of the glutes around the femur area, this is the insertion right here, and this is very tender for a lot of people, especially people who are sitting a lot. So you can come down a little, apply a little more pressure with the tip of here, or you can use the teardrop with a point. If you find that somebody says it's really, really tender, you can kind of choose the stone shapes to what lend themselves to the issue that your client has. But I like doing this also. I put the stone there. Now, Beth, can you point it over here? No, over here too. There we go, up a little higher. There we go. So as I'm perfect. So as I'm coming up, I've got the weight and the pressure from my arms, but the stone is delivering the heat for me. And I'm just coming up very gently. And I'm actually standing now. I think this is the first time I've stood in the whole session. It's just very comfortable. I'm just sitting here, I'm leaning against the table. I'm putting my weight into my arms. I'm not engaging my muscles at all. I'm not engaging my biceps. My biceps are absolutely relaxed. I'm just leaning in. And the stone is right there gliding along, and that's delivering the heat as my arm is delivering some pressure as well. And I'm doing the same on the lower leg. Now, if I had a client who was pregnant, I would come up. I would come up as opposed to down. So normally I would do this, okay? But if you have a client who's pregnant, you always want to go towards the heart. So you would come up with that lower leg as opposed to down. I'm sure that makes sense. Okay, try that one more time. Up with the lower leg. And again, I'm doing very little pressure. I'm leaning into it. Body mechanics is such an important part of extending the life of your career, because when you use your body in a creative way with your weight, you're able to have energy all day long. So I had a client last week who had a lot of tension in the IT band. So I actually used my heart shape. This is a really nice one to use on the IT band. You have a concave area here, and just very gently, I just followed along with my hands and just came down with the heart, and then around the great trochanter, right at that insertion of the glutes along the femur. Again, you can just be so creative with how you use them. So that's my highlighted spots for the side lying. Let's go into face down now. So I put on my jojoba. I've applied it on the arms, applied it along the shoulder blade, down to the lower back, and do a little tad more. Popping it down there. And then I'm going to grab my two ovals, which you guys both have. These are perfectly sized. Again, remember, lateral arm, 1 or 2 strokes is all your client needs to feel that heat. And then as you're coming down the back, you always want to move. If you stop still, the stone will warm up and it might be too hot, but probably not. As long as it's comfortable in your hand, it'll be fine for your client. I just want to do that again because I wanted to show you that as I'm coming down, I'm actually using the palm of my hand to, the heel of my hand to put some pressure on. Again, I'm leaning into it. I'm not utilizing my biceps. I'm not using my biceps. It's a very comfortable, easy work. Very easy. When I get to the bottom, we just fan the whole hip area, and then we go down here, right on the edge of the hips and the glutes. Now the stones, these ovals are nice sized, so you can still work your fingers. So as you gently pull back, you can work the intercostals a little. So you're coming up with your fingers and the intercostals. Again, the heat is there all along. Come down. As you're coming down, your heel is applying some pressure, but you've also got the stone delivering the warmth. And then you come up. And as you're doing that, you're slowly moving your way up the back until you find yourself back up with the shoulder. Now I'm going to put these two back, and I'm going to get out a circle from my bowl. Shoulder blade. Infraspinatus along here, again, highlighting and focusing on that muscle. It's so much more effective than just all over the place. So your infraspinatus is right along here, along the line of the shoulder blade. And you're coming down the infraspinatus with the stone in your hand. Your hands can work together. So for instance, my finger is right on that. I'm feeling the bone. My finger is right on the infraspinatus here. And so is the stone right behind. So it's getting some pressure, but it's also getting the heat. And when you blend the work with the heat, the muscles relax so much more. So we're working the flat part of the stone. We've worked the edge. Let's work the thickness, the width. The width is always a good way to work along the cervical area. So for instance, I'm coming up on the shoulder blade and then I flip it on its side like this. And this area comes up the neck with a very gentle twist of my wrist, right up to the base of the skull. And then you can flip it and work the edge along the skull a little bit. You know, you can actually do some of this on yourself first so you can see how it feels, or get a friend or a loved one and just ask them, just say, hey, how does this feel? Hey, how does this feel? But this is very, so you come down, up, then you can flip it on the side with a twist of the wrist. You're going up the neck and applying and supplying the whole neck area with some heat that can really, really help with loosening up those muscles, especially if someone comes in with a headache. It's really important that you guys have, if you do specialize as a esthetician or massage therapist working the neck and the shoulder area, having an adjustable headrest, because it enables you to get your client's neck in a nice stretch. And when it's in a stretch, you're able to apply some heat there. So I'll say to my client, don't lift up your head, just shuffle up as I lower the headrest. So I'm tilting the headrest down. There we go. A bit more. There we go. Great. So you can see the tilt here. And that's given my client's neck a nice stretch for me to now work. I'm going to get a small teardrop. And I've got it situated so that the point of the teardrop is in the palm of my hand, right by the heel, so that when I come up here, this point of the teardrop is actually making contact with those muscles going up. I did a total blackout of the muscles going up. Anyway, the muscles going up the neck, the trapezius, thank you, the rhomboids. Again, you're highlighting those muscles. You're highlighting them and you're focusing on them and you're putting the pressure and you're putting the weight. You don't have to have their head in this position for too long. But again, when they come in with a lot of neck issues, you really want to work that a little more. And so then I'm just going to raise it up, back up. There we go. How's that? Is that good? Yeah. Okay. So as far as the protocol for the estheticians when they are working with their facials, with their back facials, I don't really know how it's probably easier to do your application with the stones first because you're loosening up the muscles with the heat before you go ahead and do the facial, or you can do it after the facial when you've taken off the facial from their back and their backs are kind of cold and you never want your client getting cold. So you could do it then also, or either or, the beginning or the end of the facial. And then as the massage therapist who's not doing facials, you can do anything you want, as much or as little as you want. But again, it's highlighting those muscles, using the points, using the edge, using the width. This one is the larger, this is the large teardrop, and I can use that edge here, again, coming up the neck. I'm just applying it with a nice twist. There we go. Nice twist. It's very, very easy. But you'll be able to feel when you're coming up, you could lean in, lean back. So as you're applying the pressure is coming from your weight leaning back. And again, I'm sitting again and I'm just leaning back in my stool. It's really important when you're sitting, you get one of those stools, the swivel stools, as opposed to a chair. You really want to be able to have the flexibility to move around. So I've got the stone in my hand. I'm coming around the cervical area and I'm leaning back in my stool and I'm not engaging my bicep at all. All the pressure is coming from my weight, just leaning back, just ever so slightly, not a lot. Again, it's what makes it very possible to have a very long career as a massage therapist or as an esthetician by working smarter with the work that you're doing. Okay, so let me think. Just gonna show you quickly a little about the hamstrings. I had a client yesterday actually who came in and her hamstrings were really, really tight. And I just want to show you how I work them. So we're gonna go down to this leg here. It'll be the closest to the camera. There we go. So a little bit of draping there. She was an older lady, older client, and she said, you know, she had terrible sciatica. And usually, if a client has issues with sciatica, the chances are the hamstrings are going to be really tight as well. So I just applied my oil, well, my jojoba. I got my stone in my pocket, and then I started applying heat. And right off the bat, she was like, "Oh my gosh, that feels so nice." It enables you to go in a little deeper, a little sooner than if you did not have the heat. So I've got the heat here, very similar to how I was doing with the IT band, where the stone goes first, applying the heat, and then my finger follows on. My finger follows on right here with some pressure. And I guarantee we did this for probably, I would say no more than even a minute or so. I brought this up a little too, and you can just apply like this too as well. You can just be creative. We did that for about a minute or so, and then I put the stone aside on the table, and then I did the same thing that what I had done a minute or so prior before the heat. And she was like, wow, feels great. Doesn't feel tight anymore. And I hear that all the time. It's what makes me really passionate about teaching and sharing with incorporating the stones, because it will change your practice. It will change the work you do, and you'll have much better results with your clients who have really, really tight muscles. So then I was back doing it. Same with the cuffs. Exactly the same. You can apply the heat, you down the heat a few times, and then you can put the stone aside, and then you can do the work that you would normally be doing. If you need to, go back, get the stone, apply some heat. It'll just make your work so much easier. So that was hamstrings and cuffs. And you can do that with any of the shapes. You can do it with the smaller ovals, you can do it with the round ones. You can do it with any of the shapes. Actually, the heart is a nice one to go with those little shapes of the heart on the hamstring and the calf. But it really is, you can really do any of these stones you can use on any particular areas. So let's just have, I'm just going to have my client turn back onto her back again. So as an esthetician who started off with the protocol, I'm just going to do the protocol without saying too much so that you can just see. So the session's ended now. They've had their facial, they've had their back facial, and they're just so relaxed. And then we're just going to apply the jojoba here and reach over 2 circles down the arm, up to the neck. My fingers are doing the work. The stones are just sitting there. It's nice and warm in my hand. It's not too hot for my client. And it's very, very relaxing. You can even come up higher so that your fingers are around the edge of the skull, and the stone is actually on the hairline. And that's another area. People don't realize how many little muscles are still going up the skull. And so even my fingers are working on the skull, the stone is actually on the hairline, and that's very, very comforting too. So then we'll come along here, and then we're going to go up to the masseter. Very small little circles. We can flip the stone to the other side if we want a little bit more warmth. But again, it's still nice and warm, even after doing the neck and the arms. And then finalizing at the ears. And the ears are just, especially in the wintertime, it is such a wonderful way to begin and to end a session. That deep radiating warmth really penetrates in a way that no other stone can. And it's the minerals that have that heat penetrate in. Probably around the holiday times, we were going to start with having once a month Q&A, Zoom Q&A, because we often have people email us or call us, and sometimes it's telephone tagging and it's hard to get back with people. So we just figured it would be easier to do a live once a month Zoom of Q&A with the Saltstone. So any questions you have about anything with working with them, incorporating them, anything that's come up, care of them, protection, you can just jump on the call and ask a question, and we'll all hear it, okay?